We begin with President Buhari, who's decried inequitable distribution of vaccines in his address at the UN General Assembly. Director General of National Agency for Control of AIDS says more people living with HIV were linked to care during the pandemic. And South Korea records its highest number of new COVID-19 cases yet, with over 2,000 infections. Nigeria on Thursday recorded 2 additional fatalities from the coronavirus pandemic, and 433 new cases were reported across 16 states and the FCT. The latest NCDC data indicates that Nigeria's total infection from the pandemic currently stands at over 203,000. Meanwhile, 4 states, including Nasarawa, Ogun, Osun, and Sokoto states, recorded no fresh cases. Let's take a look at the update.
Is urging offices, banks, supermarkets and places of worship to ensure temperature checks at entry points and turn back anyone who registers a temperature above 37.5 degrees centigrade. Such persons should seek medical attention. The number of COVID-19 infections in Nigeria went up by 433 in the last 24 hours. This is higher than the day before by 56 cases. According to the Nigeria Center for Disease Control, the latest figures were reported from 16 states and the FCT. This time, the FCT took the lead with 191 new confirmed cases. Lagos was a long way off with 79 cases, and Anambra had 63 cases. Rivers State reported 27 cases, Plateau 13, and Oyo 10. Delta had 9 cases, Ondo had 8, Edo 7, and Gombe 6. Akwa Ibom and Borno had 5 cases each. Ekiti came in close with 4 cases. Bayelsa and Zamfara had 2 cases each, and Enugu and Kano had the least with 1 case each. No cases were reported from Nasarawa, Ogun, Osun, and Sokoto states. The overall count of confirmed cases in Nigeria now stands at 203,514. 349 recoveries in the last 24 hours have increased the total number of discharged people to 191,950. 2 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,668. Currently, there are more than 8,800 active cases in Nigeria, and over 2.9 million samples have been tested so far. In Africa, there are more than 8.2 million confirmed cases, and over 208,000 deaths have been recorded across countries on the continent. The global confirmed case count is now beyond 230 million, and worldwide, deaths are more than 4.7 million.
President Muhammadu Buhari has addressed the 76th United Nations General Assembly. Today, in his speech, which lasted less than 30 minutes, the president wasted no time delving into the issues. He began with the global initiatives at containing the coronavirus pandemic, declaring Nigeria's support for the COVAX initiative and thanking the US, China, even India for developing and distributing vaccines. While he also decried inequitable distribution of vaccines, which he says hinders global efforts at containing the pandemic.
Nigeria remains grateful for the assistance received from our partners and friends all over the world. Vaccination is the key to our safe emergence from the pandemic. We fully support the COVAX initiative, from which we have benefited. We also thank the United States of America, Turkey, India, China, European Union, and others for the vaccines provided. Despite the acknowledgement, however, I would like to reiterate my call for a fairer and more equitable distribution of vaccines in all countries, so that together we can fight and contain the pandemic. The rising wave of newer and more contagious strains makes this even more urgent.
And the National Agency for the Control of AIDS, NACA, says it has successfully identified and managed 350,000 people living with HIV/AIDS and COVID-19 since the virus broke out in Nigeria last year. The Director General of the agency, Gambo Ali, who says that the prevalence of HIV/AIDS in the country is declining, stressed that testing and treatment for both viruses will not be put to rest. This agency and its counterparts are poised to eradicate both ailments.
We have been managing the two since the coronavirus pandemic started. It may interest you to know that we did well during the coronavirus pandemic in identifying people and linking them to care. In fact, we did what we have never done even when coronavirus wasn't there. That is, during the last 18 months of coronavirus existence, here in Nigeria epidemic, we identified 350,000 people living with HIV/AIDS and linked them to care.
Well, for more on that, Dr. Yinka Falola Anumwa, Deputy Director, Head of Gender and Human Rights Unit at the National Agency for the Control of AIDS, NACA, joins us now from Abuja studios. Thank you for joining us on the program.
Thank you. Good evening, Millicent.
Good evening. Nigeria's commitment to ending the HIV epidemic in the country has never been in doubt, but surely in recent times, attention appears to have shifted to COVID-19. Now, is this the case in your view? And if it is, take us back to the beginning of the pandemic. How did HIV/AIDS patients fare?
Thank you very much. Yes, global attention is shifted and is moving towards more on COVID-19. But here in Nigeria, we continue to work with people living with HIV and to identify them and link them with care, particularly during the lockdown and between the commencement of the response to COVID-19 in Nigeria and now, like my DG said, we have linked more people to care, more people living with HIV to care. And this is possible because we work collaboratively with all our partners. Even during the COVID-19 lockdown, we have community pharmacists who were working with us to continue to ensure people get their stock for care while at home, and we were working as essential workers. We also work collaboratively with Nigeria Center for Disease Control to use the experience we've gathered over the years in managing the last biggest epidemic before COVID-19, which is HIV/AIDS, to support the national response to the COVID-19. So within this period, we were able to provide the necessary care for people living with HIV, including palliative care. And we have our partners working with us over the years, specifically PEPFAR, the UN systems, and we have Global Fund, and to work with us to also use the experience we've gathered over the years to support the COVID-19 response and also ensure that those living with HIV continue to get care. And like the DG said, Nigeria was identified as the most resilient country in all PEPFAR countries during the COVID-19 lockdown and the most difficult moments responding to HIV at the same time.
So on the issue of vaccines, which are currently ongoing now on COVID-19, are COVID-19 vaccines safe for persons with HIV/AIDS?
Yes, COVID-19 experience and science has shown us that COVID-19 actually is people with comorbidities, that is people who have other disease burden, like people living with people who are hypertensive, people who have diabetes, people who have immune compromised condition like HIV are more prone to contract the virus. And so we need to work more closely with them to ensure they maintain good health and they continue to get all their care and protect themselves from contracting the virus. But where they come down positive, of course, that would be that would be double jeopardy because they already have condition they are managing. But in terms of vaccination, there has not been any documented case negative effect of vaccination on those living with HIV. So it's scientifically proven that it's good for them to be protected. In fact, they are one of the four set of people who must get vaccinated.
Now, Doctor, in terms of the plans now and going forward in the pandemic, especially for the HIV-infected community, what are they and what would your messaging be on?
Yeah, the message that we've been taking around and working with them, over 1.9 million of them estimated to be living with HIV in Nigeria, and specifically the 1.7 million that have been enlisted in care, the antiretroviral therapy, is that they have to keep to their medication and they have to protect themselves from, by doing all of the social protection, social non-pharmaceutical methods of protecting themselves from contracting HIV, and from contracting COVID, and also get vaccinated. So we continue to take that message up. And again, we also had partners who supported us that during the lockdown and even up to now, those of them who are very indigent, who have a negative economic impact of COVID-19, they get support. We provide skills for them. Over 10,000 of them, about 10,000 of them are getting some form of support from the program that NACA runs with United Nations, UNA specifically, and we continue to use that opportunity to give them information about COVID-19. We have trained their community mobilizers who are people living with HIV themselves, who are skilled to share information about COVID-19, HIV, AIDS, and gender-based violence as they all interact and impact on each other. So the message continues, working closely with people living with HIV and all our partners across levels, up to community level in the country.
All right, we appreciate your time on the program. Thank you so much. Dr. Yinka Falola Anumua is the Deputy Director, Head of Gender and Human Rights Unit at NACA. Thank you for joining us.
Thank you.
And elsewhere, stakeholders in the university sector believe the Nigerian government is not doing enough in funding academic research, some of which could have assisted in tackling pandemics like COVID-19. Members of the Academic Staff Union of Universities, ASU Akure Zone, during a media interaction in the Ekiti State University, maintain that tertiary institutions are competent to run good academic research for COVID-19, but laments absence of required support from government.
It is just now that we got money from government to erect the laboratory. And within how many months of erecting that laboratory here, we produce all the other things that we used to help Nigerians during the COVID-19 era. The sanitizers and the rest are these things that we should be buying from Pfizer and other pharmaceutical companies. These are things government should just contract to the universities. And when you contract it, you get the best. And then the universities also can use that one as part of its IGR. Now we have the laboratories here. Government is still satisfied buying from outside. They don't even mind going to foreign companies to bring these things inside. And that is another capital flight. That is the problem we are having. Who is talking about the university education not performing enough research? Let me tell you also that some of our universities, during the period in question, we were able to produce machines to help governments on this COVID-19 thing, to the extent that government has to ask us that they want to partner with us to even produce more. Till today, nothing has happened. Why are you not patronizing your own? Because probably also is asking for 6 million naira to produce, and then if you go outside, you use 160 million naira to do the same thing.
For the third time this year, South Africa has launched another collaboration to boost vaccine research and production capabilities in the country. This time it is with US-based biotech billionaire Dr. Patrick Soon-Cheong, whose company, NantWorks, will transfer the technology within the next 3 months, with vaccine production expected to begin in 2022. President Cyril Ramaphosa, who was part of the online launch, says the technology transfer will reinforce vaccine equity, which is sorely needed globally.
Computing.
It will strengthen our capacity to clinically manage COVID-19 without any doubt. It will also embolden our capacity to clinically manage HIV, AIDS, and tuberculosis, and all diseases with a heavy health burden. Now, South Africa has the highest COVID-19 caseload in Africa, the largest number of people living with HIV and AIDS, and the massive TB problem. We do have current treatment programs for all these three, but COVID-19 has brought new challenges, not least of all resource constraints. The setting up of clinical centers for excellence will contribute to quality improvement in managing these other diseases. It will also bolster our management of cancer, which you've spoken about extensively and done a lot of work in your research. The establishment of a cancer treatment and research center by North Africa at the University of the Witwatersrand comes at a time when the rates of cervical cancer are growing. The incidence rates of this particular cancer in South Africa is higher than the global average.
And away from Africa, Germany has given more than 5.1 million vaccine doses to other countries so far. According to the German government, this was done through the COVAX alliance and bilaterally. Meanwhile, Federal Health Minister Jens Spahn expects herd immunity against the coronavirus next spring and thus an end to the pandemic. And we're hearing that for the first time. Deutsche Welle correspondent Clifford Kuhnen joins us from Berlin on the latest there. Hi, Clifford. The issue of children and vaccination has been controversial. What's the view in Europe?
Well, the health minister here in Germany, Jens Spahn, said this week that a COVID vaccine for children under 12 will likely be available from the first quarter of next year. Now, official recommendation is likely to take longer, but Spahn expects approval for a vaccine for youth to go through by the beginning of next year. The German company BioNTech, which developed the mRNA vaccine with Pfizer, said it would apply for approval of its jab for children between the ages of 5 and 11 in the coming weeks. It's a special child-sized dose. They also announced this week that their jointly produced vaccine is safe and effective for children. We're still waiting for word from the European Medicines Agency, which is the main European medical regulator. It said it's unable to give a firm time frame for possible approval. Vaccination rates have generally slowed significantly here in Europe. Just 61% of the population of the European Union are fully vaccinated. And here in Germany, around 63 or 64% of the population has been vaccinated.
Now, the anti-vaccination lobby has been quite high profile. Are there signs it is becoming radicalized?
Well, according to the Robert Koch Institute, which is Germany's top agency for infectious diseases, only around 5 to 10% of people are vehemently opposed to vaccination. But many citizens are still unsure about whether they should get vaccinated. It seems that many distrust the new mRNA vaccines, such as those from BioNTech, because they no longer work on the basis of small amounts of the pathogen as other vaccinations do. Now, this week there was a terrible incident when a 20-year-old student working in a garage was shot after a row over face masks in what was thought to be the first killing linked to German COVID rules. The suspect is believed to be a far-right supporter and COVID denier. He told German police that he felt cornered by the country's pandemic rules, and the case has raised new alarms about fringe groups fighting vaccinations and other health measures. The killing was praised on chat groups that are known to be used by the far-right and conspiracy theorists. And we've also had security officials warning of an increase in aggression in everyday life. There's been an escalation of right-wing conspiracy fantasies, for example.
Clement, maybe to a bit of politics now. I mean, Germany has federal elections on Sunday. What role will the pandemic play on the polls?
Well, the vaccine skeptics are certainly trying to influence the election, but there's not much evidence so far to show they're succeeding. Coronavirus comes third in the polls as the most important political problem in Germany after climate and environmental issues and immigration. One significant factor that the coronavirus has played has been in boosting support for the leader of the Social Democrats, Olaf Scholz. He's currently favoured to be the next Chancellor and he's currently Finance Minister. His role in putting together a package of support measures for businesses and individuals during the pandemic has won him a lot of votes. Voters are looking for experience when it comes to dealing with the pandemic, and that could also boost the ruling Christian Democrats. So it's still open. A significant number of German voters have not yet decided who to vote for on Sunday, and that makes the vote outcome even more unpredictable than polls suggest. It's something like 40% of voters are still undecided, so we'll have to wait and see.
We'll check in with you again. Many thanks, Deutsche Welle correspondent Clifford Coonan there from Berlin. And from Singapore, to tighten restrictions after a rise in infections to South Korea, which has set a record for daily COVID cases at over 2,000, breaking the previous record set last month. Here's more on the global update.
Bye.
Global update begins in Singapore, where the government says it will tighten COVID-19 curbs to limit social gatherings to 2 people and make working from home a default in a bid to contain a spike in infections and reduce pressure on the healthcare system. Despite a rapid vaccination drive, the city-state has been seeing more than 1,000 daily cases this week, including 1,504 Thursday, the highest number since the start of the pandemic.
Therefore, for 1 month from 27 September to 25 October, social gatherings will be reduced to no more than 2 persons. The number allowed to dine in at F&B establishments will also be reduced to 2, and both have to be vaccinated. For hawker centres, the number of persons allowed to dine in will remain at 2, regardless of vaccination status. Workplace interactions should be minimized, with work from home being the default, as many transmissions occurred at workplaces.
South Korea record for daily COVID-19 cases at 2,434, breaking the previous record set last month as the country grapples with a wave of infections that began in early July. The mortality rate and severe cases remain relatively low and steady at 0.82% and 309 respectively, helped largely by vaccinations that prioritize older people at high risk of severe COVID-19. Authorities advise people returning from this week's 3-day holiday to be tested even for the mildest COVID-19 type symptoms, especially before going to work. Cumulative total of confirmed COVID-19 cases in the United States topped 42.6 million as of Thursday, with the death toll surpassing 684,000, according to the Center for Systems Science and Engineering at Johns Hopkins University. The country's case count rose to 42.6 million as of Thursday, and its death toll hit 684,286, the CSSE tally showed. The United States continues to lead the world in the number of both confirmed COVID-19 cases and deaths. The Indian village of Malana, deep in the Himalayas, a COVID-19 vaccination team scrambled over a landslide that blocked the road the day before, scaled a retaining wall, and then began a 3-hour trek down an upper river valley. These workers have helped the state of Himachal Pradesh become the first in India to administer at least 1 COVID-19 vaccine dose to its entire adult population.
Remarkable story there in India. Well, it is crucial to limit the risk of COVID-19 infection among all ages. Take responsibility and don't disregard the good hand and respiratory hygiene practices. You can visit our website for more updates. You can see our breaking story there. The president at the 76th UN General Assembly and other stories. Our COVID-19 pandemic updates are there as well at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.